Welcome to the third lesson of the module on effective consultation. We have already discussed in detail how to properly start a consultation, establish contact with the patient, identify their concerns, and gather the necessary information. Today, we are moving on to the next stage, conducting the examination. This stage is no less important as it provides us with objective data about the patient's condition. But an examination is not just a mechanical procedure. How comfortable the patient feels and how clearly they understand your actions determines their trust in you and their willingness to follow your recommendations. How do you conduct an examination properly? Step 1. Preparing the patient. The examination should be clear, quick, and professional. All instruments should be prepared and in their proper places. I recommend not leaving any scary sharp objects in the patient's line of sight. These can cause panic. Everything should be covered, put away, and taken out not in front of the patient, but behind them. If your clinic has a special consultation room without a dental drill or other equipment, that's ideal. In general, during the consultation stage, I don't seat the patient in the dental chair. He sits with me at the table, and I only invite him to the chair afterwards for the examination. But of course, there are different approaches. Some dentists conduct all stages of the consultation in the dental chair. Choose the option that is most comfortable for you and your patients. Before starting the examination, make sure the patient is ready. For example, you can use phrases like these. Ivan Ivanovich, now let's move on to the examination. Are you ready? Or Ivan Ivanovich, would you mind if we proceed to the examination? Then let's go to the chair. If at any moment you feel uncomfortable, just let me know and we will stop. During the consultation, it's better to address the patient politely and by their full name. In my country, we use patronymic names. For you, it might be something like Mr. Johnson. A little life hack for young professionals to raise, so to speak, their authority. It is advisable that dental clinic staff address you by your full name and regalia at least 3 times in front of a patient. For consultation, even if you and your assistant are best friends and use informal language with each other in everyday life, you can agree that at some point during the consultation, they will address you formally. For example, Marcus Lanovich, do I need to support this? Or, Marcus Lanovich, can I help you? This needs to be done at least 3 times. For instance, the first time it can be said by the clinic administrator. Hello, you have an appointment with Mark Ruslanovich for a consultation today. Then the assistant says, hello, let's go, I'll take you to Mark Ruslanovich. And several more times during the consultation itself. This approach will help increase your authority in the eyes of the doctor. Step 2. Explaining the process. The patient should understand what is going to happen. Use simple language and avoid complex terms. Studies show that 38% of people experience anxiety during dental procedures. And that's not to mention visits to other doctors, like gynecologists or proctologists. According to the study, 38 patients experience anxiety during dental procedures. Even such painless procedures as 3D oral cavity scanning can cause fear due to not understanding what is happening, the feeling of losing control, and helplessness in the chair. It can be a fear of the unknown. What is the doctor going to do now? It could be fear, imagined pain, or discomfort. Your task is to minimize the patient's fears and let them know that you are on their side. How can this be done? Through clear explanations, predictable actions, and emotional support. Studies in 2017 confirmed that clear explanations from the doctor reduce anxiety by 40%. And back in 2007, it was noted that patients, both children and adults, are more often afraid not of pain, but of the unpredictability of the dentist's actions. That's why explaining your actions is not just a matter of politeness, but a way to reduce stress and create a comfortable environment. It will also be easier for you to work if the patient relaxes and doesn't flinch. For example, you can use phrases like, now we're going to lay you back horizontally and place a lip retractor. This is necessary to make it easier to examine your teeth. Then I will analyze the condition of all your teeth, your bite, and your oral mucosa. After that, we'll do a small diagnostic procedure and create a 3D model of your teeth. And at the end, I'll return you to an upright position. Is everything clear to you? Do you have any questions? You can choose for yourself which way of visualizing this information for the patient you like best. I mainly use intraoral scanning, but it could also be, for example, a photo protocol, or maybe you prefer photographs. Actually, that's the next step. Step 3. Photo protocol or intraoral scanning. Many patients don't understand why photographs and dental scans are necessary. Your task is to explain everything to them. How can you do this? You can say, now we will take a few pictures of your teeth. This is needed to document the current condition of your oral cavity. To assess the progress of treatment, compare changes after treatment and show you problem areas. We will see the image on the screen and discuss everything in detail. We will send the results of the report to you via WhatsApp and after the consultation. You can also send everything by email using the file sharing method that is most common in your country. It is important to convey to the patient that during the examination we are preparing for the next stage. And for this, visualization is necessary, either a photo protocol or 3D scanning. If a CBCT or another type of scan is required, explain its safety and benefits. For example, to make a more accurate diagnosis, we need to take a 3D image of your teeth. If the patient is concerned about radiation, reassure them by saying, for example, that CBCT is a modern and safe method and the radiation dose is very, very low. To exceed the annual norm, you need to take more than 15 photos, but we only take one. I like to use the banana example. The average banana contains approximately 0.1 mL. For example, a human CBCT scan is approximately 40 to 100 mLs. This means that one photo is equivalent to approximately 400 to 1,200 bananas. To get paid, to receive a dose of radiation dangerous to your health, you would need to eat about 10 million bananas. That's about 1.5 tons. Such everyday examples are often easier for people to understand than just units of measurement. In general, I believe that patients should be actively involved in the process and everything should be explained to them. For example, I teach patients how to understand a CT scan. For example, I say, if you want, I can explain how to use this. The black areas in the image are empty spaces or cavities. The white areas are something foreign. Those are fillings, implants, all the things we've added. And the gray areas are your natural tissue. After that, I start explaining tooth by tooth. I also tell patients that the image is analyzed not only by the doctor, but also by artificial intelligence. This is a double check that eliminates the risk of error. In our clinic, we use the DiagnoCat service. It's a virtual assistant for analyzing dental images, which processes both 2D and 3D images and provides a clear and detailed report. It only takes a minute. The report includes a treatment plan and allows you to clearly show the patient the connection between the condition of their teeth and the necessary medical procedures. I love this program because it's very convenient. All patient data can be stored in one place, shared with other specialists, and you can view images and scans on any device without any special software. Well, maybe, but it could also be another program that you like more or that you already use in your work. Overall, there are now many different programs and services that make doctors' work easier and faster. I'm convinced that they are the future, so it's definitely not worth neglecting them anymore. But let's sum up the key aspects of a comfortable examination. First of all, maintain constant contact with the patient. Explain what you're doing. Now I'm going to check the sensitivity of this tooth. Ask about their sensations. Are you comfortable? Is the holder pressing on you? Use words of encouragement. You're doing great. You're doing an excellent job. Secondly, minimize discomfort. If the patient is tense, offer them short breaks. Use a mirror to show problem areas. This will engage the patient in the process. Visualize the data. After the examination, show the patient the images on the screen and again involve them in the process. For example, let's look at the image together. Here we can see it right here. This, and this. Also, don't forget that the assistant is an important participant in the process. I've already mentioned this. For example, if you're doing a photo protocol, ideally, while you're talking to the patient, the assistant should process the photos and upload them to the computer so you can show them to the patient and discuss everything. And most importantly, not waste time on this. Mistakes to avoid. A silent examination. The patient feels like an object, not a participant in the process. Abrupt movements. They can frighten the patient and provoke anxiety. Neglecting explanations. Why take photos? Why do a CBCT scan? If you don't explain anything to the patient, they might refuse further treatment. Remember, the patient is not a doctor. They don't know everything you know. What is obvious to you may not be obvious or clear to them. The scariest thing for a patient at the dentist is when an instrument is dropped, in particular, the sound of metal clanging. This can also really frighten the patient, but if it happens, it's better not to draw attention to it. As they say, this is fine. As you can see, an examination is not just about diagnosis, it's an important part of communication and the only opportunity for verbal and tactile interaction. If the patient understands the process and feels cared for, they are more likely to agree to treatment. It's better to follow the recommendations. They're also more willing to return to the clinic. The main rule is that the patient should leave not only with a diagnosis, but also with the feeling that they were listened to, supported, and everything was explained to them. In the next lesson, we'll go over the stage of explaining and planning treatment. I'll tell you how to convey information so that the patient makes the right decision. Now, let's move on to practice. First, write down for yourself the main points and useful ideas from the previous lessons. In the supplementary materials, there will be a Google form. Send your answers to me and we'll check if everything is clear to you. Second, be sure to try applying these principles at your next consultation and you'll notice the difference. Train your brain and see you in the next lesson.